Okay. Yesterday we talked about trisomy, the first example of trisomy, which is the most common example for it, trisomy 21. Now we will complete to talk about another trisomy, which is trisomy 18, or it's called also Edwards syndromes. Of course, it is less an incidence than Down syndrome. And from its name, the trisomy 18, so there is an extra chromosome, its order is 18. And its incidence of this disease is about 1 in 5,000. Like trisomy 18, here there is an increase in the risk of incidence, like increased maternal age, because the mode of affection here, yes, it is a genetic problem. It's by what's called the non-disjunction. This is for all trisomy, starting with trisomy 21. And a minority of them, it may be because of translocation. So because the mode of affection is by non-disjunction, so there is a high relation between the increased maternal age and increased incidence of this disease. Like other chromosomal abnormalities or like other congenital abnormalities in general, most of the cases ended with spontaneous abortion. And just minority of them reached to complete the full gestation. For those with the trisomy 18, we said it is 1 in 5,000, but actually about 95% of patients with Edwards syndrome, they are stillborn, and just 5% they are live born. Why they reach to the end of gestation but may born as dead babies? Because of the severity of congenital heart disease, or if they develop apnea, there is no response to resuscitation. And you remember we said if we find a trisomy 18 or trisomy 13, but it is confirmed by diagnosis, by prenatal diagnosis, so there is no need to start resuscitation with them. Now, what about the clinical or the phenotype of patients of trisomy? This picture illustrates all the abnormalities can be seen in that patient, starting from the head. In general, patients with trisomy are small in age, small in size, sorry. So you can regard them, one of the small for gestational age is the trisomy 18. The head, again, it's small. So we have microcephaly. Going to the forehead, we have a prominent forehead. And going to the nose, we have an upturned nose. The eyes are maybe of normal size, but there is a hypertellurism. But there is an upslanting in Down syndrome. Here is a down slanting. This is meaning the inner canthus of the eye, it is higher if we draw a horizontal line between the inner canthus and outer canthus. Normally, it should be of the same level. In upslanting, the outer canthus is higher. We see this in Down syndrome, but in Edwards syndrome, there is a down slanting by the inner canthus is higher than the outer canthus. And there is hypertellurism, as I said. And this is mean increase. We have two terms, hypertellurism and telecanthus, and there is a specific or precise differentiation between them. But we say hypertellurism, it's increased the distance between the two eyes. It is vigorous, can be seen by the observers. If we go to the mouth, so here we have a very small chin, and this is called micrognathia, but without protrusion of the tongue. If we go to the back of the head, we have a prominent occiput. So but this is not affecting or increasing the OFC because the whole size of head is small. So it's microcephaly, but there is a prominent forehead, and at the same time, there is a prominent occiput. The ear, of course, will be of low-set ear with a posterior rotation. Neck abnormality is not significant, so there is no neck abnormality. Going to the hand, very important. Babies with Edwards syndrome, they have abnormal fist of the hand. This is called the clenched hand with overlapping of fingers. So you can see here, the second finger is over the middle, and the fifth finger is over the fourth. This is called the overlapping of fingers with always a clenched hand, abnormal fists. If you go to abdomen, they have umbilical hernia, and sometimes they may have omphalocele. Part of the intestine is out of the abdominal cavity, and sometimes there is a viscera without it, with it, liver or spleen. In the hip, there is a limb or limited hip abduction. Other important feature can be seen in patients with Edwards syndrome is the rocker bottom feet, like this. So it is the opposite for the normal arching of the feet. There is a prominent calcareous bone, and there is a upward arching, not the normal arching. This is called the rocker bottom feet, which is like the rocker bottom chair or full rocker bottom chair. Now, what about the mentality or the intellectual dysfunction in those patients? Of course, they have severe intellectual dysfunction. But before this, we will talk about the internal abnormalities can be seen in patients with Edwards syndrome. Starting from the heart, they have either VSD, ASD, or PDA. For GIT, I say there is omphalocele. There is renal defect also. And then a lot of types of renal defect may be ended with renal failure. And these, of course, affecting the life expectancy of the patients with Edwards syndrome. So only 5 to 10% of them, they celebrate the first birthday. And just 1% reach to the age of 10 years. And the median age of them, meaning good median, so it means about 50% of them, they die within several days after birth, maybe up to 14 days of life. Intellectually, they are severely mentally disabled if they pass the obstacles of the physical obstacles and reach to the age of maybe one of the 10, 1% reaching to the age of 10 years. Now we will see how the genetic or the karyotyping of those patients. Of course, we say there is an extra chromosome in the order 18. Another picture shows the low-set ear, the hypertellurism, the upturned nose, the small jaw, or what we call it, the microcephaly, the rocker bottom feet, and the clenched fist when and overlapping of fingers when the index over the middle and the little over the ring finger. So, of course, this is a clear slide of patient with Edwards syndrome. How we comment on this? We can say there is hypertellurism, down slanting of the eyes, upturned nose, microcephaly. We can say there is a low-set ear, and you can recognize the abnormal fist or clenched hand with overlapping of fingers. Again, this picture shows how the baby has hypertellurism, increased distance between two eyes, the down slanting, the upturned nose, and of course there is a small jaw and low-set ear. The same baby in the first slide here appeared to show the hypertellurism, the down slanting eyes, the upturned nose, low-set ear, and lower jaw, and small jaw, sorry. So this picture is clearly showing the low-set ear when you draw an imaginary line between the outer canthus, though it's covered here, with the occiput, so the ear is completely lies below this line, And you can see the abnormal fist with the clenched and overlapping of fingers and the small jaw also. This slide showing very clearly how is the abnormal fist or clenched hand of those patients, and this is also the same. Always doing this posture. This is the rocker bottom feet, the prominent calcaneus bone, and the upturned or the upward arching of the feet, like this and this, but sometimes may be milder than this. So this is the rocker bottom feet. Take the name from the rocker bottom chair if you don't see it before. Now we will go to other trisomy, which is least in incidence. This is called the trisomy 13, Patau Syndrome. Patau Syndrome. So here is the incidence is about 1 in 10,000 and even maybe up in 20,000, trisomy 18. From its name, so the extra chromosome here is found in the chromosome order, which is 13, of course. Here is a lot of, what we say, a lot of congenital deformities, abnormalities, are more severe than what's be seen even in the Edward syndrome, making the life of those patients is very difficult to start or to overpass these congenital abnormalities, making them compatible with life. Here is the increase in the maternal age also play a role as a risk factor because of the non-disjunction. It is the mode of affection in this trisome. Starting from the phenotype of those patients, we have from the top of the head, from the vertex, we have what's called the cutis aplasia, which is the absence of the skin of scalp on part of area of the head. If we go to the face, here we have, of course, we have microcephaly, and I will skip the whole of prosencephaly because I will explain it more in the next slides. If we go to the eyes, we have what's called the microphthalmia, and there is a HypoHyperTellurism, decreased distance between the eyes. The face may be like this. So the patient may have microphthalmia, HypoHyperTellurism, and cleft lip and palate, which is the milder form of disease. But in severe disease, the morphology of those patients will differ. Now, the hand is like of the Edward syndrome. They have abnormal fist, clenched hand, overlapping on fingers. Adding to that, they have polydactyly, extra digits. The abdomen, they have umbilical hernia or omphalocele. And also they have rocker bottom feet. Internally, congenital heart disease in form of ASD, VSD, or PDA. The same in Edward syndrome. And renal defect also may present. We said the incidence of those patients is 1 in 10,000, and it may reach 1 in 20,000. Now, what about the intellectual disabilities? Also for those live-born, there is a severe intellectual disability. Not like the Edward, not like the Down syndrome, which is mild to moderate. And what about the life expectancy? Most of the babies are stillborn, but those who are live-born. The median age is also just maybe up to 10 to 15 days. And a small minority of them may be up to 15% reaching to the first year, and a very, very small minority of them, rarely they can pass for the 10 years or even reaching to the pubertal age. Stereotyping of patient with Patau syndrome. There is extra chromosome in 13, chromosome 13. And the problem of those patients, I will talk in details. It is not just the abnormality in the face, mid-face abnormalities, or what we say, this morphology. Here, it is connected or linked to abnormality in the brain. You see here the normal brain that is differentiated into two hemispheres, and it is connected by the corpus callosum. And here we have the lateral ventricles, third ventricles, and the fourth ventricle may be seen in other level lower than this. This is the normal brain. By the way, the brain, how many parts of the brain we have? How we can classify the brain? Anatomically.
cerebrum or cerebellum والبراينستر.
But they have another terms.
Forebrain and midbrain and hindbrain.
Forebrain, yes, which is the cerebrum. Midbrain, which is the brainstem, and pons and medulla oblongata, and hindbrain, which is the cerebellum. So the problem here is in the forebrain, in cerebrum. This is the normal differentiating, but in holoprosencephaly, there is failure of differentiation of the two cerebral hemisphere, and it may appear in more severe cases. This is the most severe case of the holoprosencephaly, like a one hemisphere. There is no differentiation. And you can see the ventricular system, how it's affected by this. And there's no corpus callosum, of course. So this is null to the holoprosencephaly, or VS the holoprosencephaly. Now, these happen with Patau syndrome. So normally, you can see here, we have 3 levels of the holoprosencephaly. First, called the lobar. The second, called the semilobar, as you see here. And the third, which is the most severe, called a lobar. Just one lobe, like the previous slide. These abnormalities of the differentiation of the brain is associated with abnormalities seen on the morphology of the patients. So for those with just normal brain, they may have A, which is median cleft lip and palate. You can see here, see them. A, HypoHyperTellurism, small distance, narrow distance between two eyes, and the cleft lip and palate. So this is the mildest form, and brain is normal. Those who can survive, if they are living born, of course. Yes, most of them are live born and can survive. They can survive. B, this is called the Cyclopia. Cyclopia. Here, there is no cleft palate, but there is just one nostril. Remember, this is a mid-face abnormalities. And the eyes, yes, they have normal eye. Normal, I mean, two eye in two orbits. Yes, they are microphthalmia and with HypoHyperTellurism. If you go to most or more severe degree, which is C, it's called Microcephaly. Here is the brain as semilobar holoprosencephaly, and the face appear like this. There is no nose, absence of nose. And instead of this, the patient have this piece, which is a blind and a prominent or projections of skin and cartilage called propaces. Propaces in Arabic means خرطوم. سموها propaces because it resembles the propaces of elephant. It is above the eyes. It is not functioning. A blind ant, just like a nose. And the eyes, they have two eyeballs, but in two fused orbits. There is no space between the orbits. If you go to the most severe form of holoprosencephaly, which is a lobar, like the previous slide, here they have propaces, of course, no nose, and just one eye and one orbit like this. واحد يشوفه يخترع. Of course, the Ethmocephaly and Cyclopia, they are stillborn. And in our hospital, we see more than one case per year with Ethmocephaly or Cyclopia. And they are stillborn, as I said. So now I ask you, what is the name of this degree of this patient with Patau Syndrome?
سيميلوبلر دكتور. عنده بس مايكرو شو اسمه كليفت ليب، وشويه عنده هايبوثيراليزم، يعني مايلد.
هذا الميديان cleft lip and palate. هذا the mild. So there is here, the brain is normal. There is no holoprosencephaly. While here, this is the most severe form. Here is سميناها Cyclopia. أين سميناها Cyclopia, because one eye and one orbit and the propaces. So here, lobar holoprosencephaly. عايش نسميها
Ethmocephaly.
Ethmocephaly. Two eyes fused in one fused orbit and the propaces above it. Here, the semilobar. نسميها السيميلوبر هنا. شو نسميه هنا البروسنسفالي؟
Posterior.
ايه degree of holoprosencephaly شو نسميها؟
Similobar.
Semilobar, yes. Here is the lobar with Cyclopia. Of course, both of them are stillborn. This patient with just a cleft lip and palate and HypoHyperTellurism, she is managed and alive to this level, but unfortunately, she is still on the endotracheal intubation. Even a reconstructive surgery done for her. Now, this patient from our ICU, he is stillborn. You can see the abnormalities. Who can enumerate abnormalities seen in this slide? Yeah.
Propaces.
Propaces, yes.
Extra fingers. Polydactyly.
Polydactyly. Where is the polydactyly?
بالرايت هاند. اكو جاي
Just
وبالفيت اليسرى.
Yes, polydactyly in both hand and feet. Yes.
نعم دكتور.
بعد
دكتور الهير مالته لانوجو هير.
Lanago hair, yes. Lanago hair is a normal finding. Normal birthmark. Okay. بعد
Nearly all the finding I can see.
زين ومدى تشوف يعني شفت بس البروبسز ما بينت عندك هاي سنجل اي؟
ما جاي من السايد ما جات بين سنجل ولا.
Okay.
From the side.
Now, شوفوا البروبسز. It is a projection, a cartilaginous projection with thick skin. Above the eyes, it's not functioning. And here is a cyclopia. You can see it. because we have just one eye and one orbit. Here is the polydactyly of this patient. Of course, long hair he has, but this is normal. Here is the polydactyly in the lower limbs and the feet, and of course, he has long hair. This is the cutis aplasia. Cutis aplasia, we say it is an area of absent skull. One of the presenting signs of the Patau Syndrome. Here is the polydactyly. The polydactyly may be just a skin and a subcutaneous fat, or it may be, yes, a true finger. It may be there is a bone, true finger. And of course, we have here the overlapping of the fingers. This patient with Prater Syndrome reaching the age of 16 years, which is very rare to see this patient, so it's reported. And you can see her story on the Google sites, on many sites on Google. Of course, she has the mildest form to survive, and she undergo the reconstructive surgeries. But of course, she has mental retardation. Now we are out of the chromosomal abnormalities, and we will going on and talking about the dysmorphism or dysmorphology. Here is the normal setting of the eye and the low set of the eye. If you can see patient from the front, you can say this is low set or normal set. But for proper determination is by, by what? By drawing the imaginary line between the outer canthus and the occipital protuberance to see. So this patient now, if you do it, you can see he has two abnormalities, low set ear and the cleft lip, and it may be associated with the cleft palate. Many causes for this. This patient has also low set ear. The line, if you draw it between here, the outer canthus and the prominent occiput, so it looks like below it. This is again a clear picture to show the low set ear with micrognathia also. And the prominent head, forehead, and prominent occiput. We talk about the HypoHyperTellurism, and this is the meaning. This is the normal distance, and this is the abnormality, narrowing or increasing the distance. We talk about the slanting of the eyes. This is the normal. When we say the inner canthus and outer canthus on the same horizontal line, but in Down syndrome, it is up slanting, or what's called the almond. And in Edwards syndrome, down slanting when the inner canthus is higher than the outer. Now we will talk about
التيروليزم، يعني ايش قد احسب المسافه؟
مو حساب، ما نحط يعني نحسبها distance وهاي، بس هي like this. زين؟ هاي distance between two pupils. نشوف هاي البيوبلز، هي هاي الترو، هاي distance between two pupils تعادل one eye. إذا if it increase more than this هاي تعتبر hypertellurism.
والهايبو دكتور؟
الهايبو if it decrease like this. ترى normally you can see patient in street يعني زين. in life ممكن نشوف ناس عندهم شوية mild hypertellurism وعندهم بعضهم شوية عندهم mild hypotellurism، لكنه normal variation هذه. الديسمورفولوجي يعني مو كلها part of disease. هسه راح اخليكم تمشون تباوعون بالناس، هذا شو شكله hypertellurism. واي يعني مارلين روح صورة مارلين مونرو زين، اذا تباوع على الشكل راح تلقى عندها شويه هايبرتيلوريزم، تحس انت يعني فشي غير طبيعي انه شويه there is increased distance. طبعا مارلين مونرو هذه طبعا مو غيرها، تلقى شويه اكو increased distance between both eyes. زين هسه abnormalities of the skull. Normally the newborn is born with how many sutures? They have like this 4 sutures, and there is a suture between the temporal and a parietal bone also. So metopic suture, which is between 2 frontal bones. So normally the newborn has 2 frontal bones, but they are fused later on to give us 1 frontal bone. وما عندنا 1 frontal bone, we have 2 frontal bone. And we have the coronal suture between 2 frontal bones and 2 parietal bones. And we have the sagittal suture between 2 parietal bone. So the bone effect between the area of meeting of these sutures, it is diamond in shape, and its normal diameter is 1 to 4 cm. This is called the anterior fontanelle. If you go backward, during the sagittal sutures, going to, or through the sagittal sutures, going to the back, we have the, what's called the lambdoid suture. It is between the occipital bone, so we have only 1 occipital bone, not 2 like the frontal. And the result is a triangular fontanelle or triangular bony defect called the posterior fontanelle, which is up to 1 cm. Normally, the posterior fontanelle should close in the first 3 months of life, while the anterior fontanelle may extend open, may still open until the age of 18 months, but it may be closed earlier. So these are the normal sutures of the brain, and these are the normal fontanelle. But if you feel the sagittal suture and you found a bony defect between the anterior and posterior fontanelle, what do we call this if we found it? If we have a bony defect within the sagittal suture, is it normal or abnormal? Why there's no answer? شباب تسمعون ولا لا؟
نعم دكتور يا.
ليش صافنين؟ واحد يجاوب هسه. If you find a bony defect within the sagittal suture, يعني هنا من هنا لهنا, is it normal or abnormal?
abnormal دكتور.
What is the name of this abnormal bony defect? ما حد سامع لا قفة شايفة مو العام يمكن كنا نحكيها بالgeneral examination for dysmorphism. This is called the third fontanelle. Third fontanelle is absolutely abnormal, can be seen in patients with Down syndrome. So it's abnormal, just 2 fontanelles. Now, these sutures, normally they are not fused at birth, and they are not ossified. And the normal bones of newborn, it is cartilaginous. So if there is increased intracranial pressure for one cause or another, there will be increased distance between the sutures, given the state called suture diastasis, which is abnormal, of course. But normally the suture should be one adjacent to the other. Sometimes we have what's called the overriding bone. That is a normal happening, normal event in vaginal delivery. So it is normal to find one bone of this skull is over the other, but with time it will resolve. فهذا اللي يقول لك راس ابني مصفح، راس ابني معنجر، ما ادري شنو، لا اقول له with time it will resolve. سولفنا عليها. This is happen at the same time with molding. فيرجع to the same level. لكن we should palpate the sutures, still not fused, of course with fontanelle. Normally, all sutures should be closed or fused at the same time at an appropriate level of growth of a brain. If there is premature fusion of one suture or all of the suture, this is called craniosynostosis. Craniosynostosis, it is premature fusion of sutures of the skull. If all sutures close at the same time prematurely, given a small head, microcephaly. But if one of the sutures close and the other is still open, so this lead to abnormality in the shape of the head. And we have a lot of abnormalities caused in cases of craniosynostosis. Here is here. Here is here. Here. Now, this is the normocephaly. All sutures are present here in the middle. But if there is a premature fusion of the metaboc suture, so there will be a compensatory expansion of the coronal suture. Why this compensation happen? Because the brain is still growing, and he look for a space for the growth. من اللي يقدم هذا? The expansion in the other sutures. Of course, this will alter the normal shape of the head. فش يصير عندنا هنا يسموه trigonocephaly. تحس انه عنده prominent forehead وتحس كأنه صاير راسه مثلث. If you see from above. If the fusion was in sagittal suture, the expansion will be on both axes, on the coronal suture and on the lambdoid. This will give the picture of scaphocephaly. If the fusion, the premature fusion, was in the coronal suture, so the expansion will be in the sagittal suture level, leading to increase the lateral diameter of the head and giving the picture of a brachycephaly. And if the fusion happened in one side of lambdoid suture, here, on this side, or in this side, so the expansion will happen on the other part of the head, given that in this part of the lambdoid suture, يعني يصير fusion هنا فصار expansion in the other side. ايش يعطينا؟ يصيحوا له posterior plagiocephaly. But if the fusion happened in one side of the coronal suture, so the expansion will happen on the other side, given the picture of anterior plagiocephaly. Anterior plagiocephaly, posterior plagiocephaly هو أبو راس المصفح. سامعين بهاي المصطلح؟ واحد يجوز الشاقة يا صديقي يقول له قوم أبو راس المصفح. أبو راس المصفح هو عنده craniosynostosis. لو one side of the coronal suture or one side of the lambdoid suture. وهواية النورمال population راح تشوفوهم إذا ما منتبهين عليهم راح تلقون ناس brachycephaly, scaphocephaly, trigonocephaly أو عندهم plagiocephaly. بس راح تطلعون من هذا السيشن شغلتكم شنو تسوون؟ تبايعون ديسمورفولوجي من عيونه هايبرتلوريزم، من ابو سلانتنج، من سمول تشين، زين، من لوسة اير، من كلها راح تبايعون عليها. واول شيء يمكن راح تشيكون واحد يشيك على الثاني ما بيناتكم. لازم اكيد. هذا السكافوسيفالي. السكافوسيفالي قلنا يصير expansion of the lambdoid and coronal suture. فراح يصير increase in the anterior posterior diameter. anterior posterior diameter يعطينا شكل السكافوسيفالي. from front is a narrow face. Profile, lateral profile, and this is orthostatic profile. وهذا هو from above. Brachycephaly هو هذا. Brachycephaly صار expansion on the level of the sagittal suture. لأن الكلوجر صار وين؟ on coronal. ايش صار؟ صار عنده broad head, high forehead, like this. دول كل شوي تلقوهم. وهنا from above increase lateral diameter. أول راس المصفح هو هذا in between. بس هسه يريد واحد يقول لي هذا plagioccephaly. تيجي تباوع له من يعني from the front تلقى جهة من راسه صاعدة فوق الثانية. زين. هذا شو نسميه هسه؟ وش type of plagioccephaly؟ anterior posterior شنو اسمه هذا؟
posterior دكتور. الليمبويد شو اسمه؟ suture صار early closure.
وليش ما
يعني
ليش ما
البالجنج
هسه-
مبين على البوستيريور.
bulging مبين على البوستيريور. زين هو هسه من الامام شو لقيته؟ مو مبين اكو عنده elevation on one side of the head. هاي الصورة جمعت لنا اثنيناتهم. This picture زين showing both. هذا posterior plagioccephaly لهنا صار لك expansion. وهذا anterior plagioccephaly صار لك expansion اللي هو هذا rarely انه يصير يعني هيك بهالطريقة هاي. زين؟ بس هذا على مود يراويك شلون يبينون. واضحة الفكرة؟ So both anterior and posterior. هاي normal or sorry real picture. هذا أكيد normal. هذا منو؟ أحد يقدر يقول لي هذا شنو؟
plagioccephaly
لا لازم يحدد لي.
posterior.
هذا posterior واضح. هذا أكيد brachycephaly. And this is the narrow with increased anterior posterior diameter. هذا أكيد هو السكافوسيفالي. زين. احنا قلنا هاي ممكن تكون normal variations وممكن نشوفها in يعني normal persons. طبعا اذا نجي نباع عليهم ذولا فواضح هذا اول واحد. هذا اول واحد شبيه مخترع من ذولا يمكن شكله. ذولا شنو شبيهم رؤوسهم. اي هذا normal head. The second one شنو هذا شو تقولون عليه؟
plagioccephaly.
second one
second one من اليمين.
طبعا اكيد يعني حطينا اول واحد normal head فاكيد second one from the left from your left hand.
plagioccephaly.
لا لازم نقول anterior or posterior.
anterior حسب ما دا أشوف هسه.
anterior لأنه abnormality seen from the front. So this is anterior. زين. هذا اللي بصفه of course he is brachycephaly. شوفوا high forehead و increase the lateral diameter. هذا أبو narrow face elongated. He is scafocephaly. لو نشوف السكافوسيفالي by X-ray شوفوا expansion between the coronal and the lambdoid suture سوت لي هاي prominent forehead and the prominent occiput. السكافوسيفالي ممكن نسميه sagittal craniosynostosis لأنه premature fusion happened in the sagittal suture. ممكن نسمي البراكيسيفالي coronal craniosynostosis والplagioccephaly according if it is involve the lambdoid or the coronal suture. زين. The matter is not just abnormality in the shape of the head, but it may affect the growth of the brain. So the importance and the significance of patients with severe craniosynostosis, if it's affect the growth, normal growth of brain and leading to intellectual disabilities or sometimes may affect on the vision leading to blindness. Of course, this patient has ايش عنده هذا؟
Scaphocephaly.
Scaphocephaly. Yes, this is a scaphocephaly. Yeah. And of course, this patient has. Yeah, this patient has.
Posterior Ablation.
This patient has
Brachycephaly.
brachycephaly. هذا brachycephaly. لكن هذا ايش عنده؟ posterior plagiocephaly. وهذا ايش عنده؟ هذا طبعا هم عنده brachycephaly. شوفوا sometimes the baby is born يعني هذه normally او مو normally هو لا normally born normally. قلنا يصير premature closure. Sometimes it may be part of disease. ممكن يكون isolated craniosynostosis or it may be part of disease presented with craniosynostosis. But sometimes the problem is simple. سببها postural. يعني الأم putting her baby always on one side of his head. راح يصير changing in the shape لأن هذا بعد cartilaginous bone. فممكن هواي نشوف أطفال يراجعونه بعمر الشهرين 3 أشهر عندهم plagiocephaly. I mostly happen with the plagiocephaly and in posterior plagiocephaly. والسبب postural. Asking the mother, she said yes. I put him always on that side. نقولها changing the side alternative with time regain the normal shape of the head لأنه راح يصير يعني القضية مو fusion لأنه ما صاير fusion of suture بعده لكن the shape of the bone is affected by the posture of the baby. بس إذا استمر ممكن leading to plagiocephaly really يصير صدق أبو راسي مصفح. هذا سيشن ايش عنده؟ What is the type of abnormalities? منو who can comment on this slide?
Slide show the child with the HypoHyperTellurism, large head, and upturned nose.
اي يعني ايش عنده هذا؟
يعني احتمال باتو syndrome.
لا ما باتوا تعشوا وراحوا لأهلهم. اي لا منو بعد doing comment on this slide? يا شباب عم نقول شباب نقصد يعني الشابات
Prominent eyes.
من نقول شباب الشابات involved لا يغلسن.
Prominent eyes.
Prominent eyes. Yes. شو يسميها prominent eyes medically?
دكتور exophthalmos.
exophthalmos. وبعد ايش عنده هذا؟ prominent
Losset ear.
losset ear. Yes. We can say this is a losset ear. وبعد ايش عنده؟ prominent high forehead. Actually this is one shape of craniosynostosis واللي هو brachycephaly. هذا لكن هذا it's not an isolated. It is a part of disease called a Crouzon syndrome. So what is a Crouzon syndrome? It is hereditary disorder, autosomal dominant in inheritance. The patient has brachycephaly. يعني عرفنا premature fusion of the coronal suture. They have losset ear, yes. They have exophthalmos, yes. They have hypertellurism and maxillary hypoplasia. And the side profile of this patient, they have flat face or sometimes even depressed because of the maxillary hypoplasia. شلون اللي يصير بالداون syndrome قلنا يصير عندهم flat face. This patient may have heart disease in form of PDA or coarctation of aorta, and they have intellectual disabilities and blindness. لأنه growing brain effect on the optic disc ممكن or optic neurons leading to blindness. هذا Crouzon syndrome وأكو عندنا فد واحد resembling it called Prater Syndrome. يصير عندهم abnormality. هذا اللي تشوفوه شوفوا الإكزوفثالموس the flat facial profile in this patient. The same here. طبعا هذول ما عندهم لوستير لكن not necessarily all the clinical feature present in patient with disease. هذا تشوفوه flat profile with exophthalmos. بس لا هذا اريد وحده من البنات تجاوب عليه اكيد يعني ما راح يعطون المجال for يعني male to answer on this beautiful slide. ايش عنده هذا؟ يلا يا بنات.
Micrognathia.
Micrognathia. Very good. بعد.
Lost ear.
Lost ear. Very good. زين. هذا عندنا هنا severe micrognathia. مو micrognathia عادية. Severe micrognathia causing retracted chin. صحوا لها retrognathia. مو بس micro retrognathia. This patient also has lost ear. واضح هذا lost ear. هذا اللاين هسه اريد المده من هنا يروح علينا يطلع لين يوصل هذا اللاين. And small chin, very small chin. أنا يعني في simulating picture. So micrognathia, retrognathia. The lower jaw يعني goes backward. سوى عندي tongue goes backward also, pressing on the upper airway, and it may cause obstruction. This is called glossoptosis. Glossoptosis. And they have also شنو هذه هنا ايش عندي؟ ايش عندي هنا؟
Cleft palate.
Cleft palate. So those patients, they have what's called the Pierre Syndrome. Pierre Syndrome. We can see it in a practice. Yani at least I saw 2 patients with the Pierre Syndrome in the last couple of years. And they have the problems of the Pierre in form of cleft palate, retrognathia as we said, بعد شي صار عندهم glossoptosis as we said, لأنه pressure, obstruction of the airways, upper airway obstruction, we said, feeding difficulties, of course. Those patients, of course, they have feeding difficulties because of the cleft palate and because the tongue closing, obstructing the upper airways. So, this the proper action with those patients. They should put on a prone position or side lying if they are awake. No, not just if they are awake, even if they are sleepy. Why?
Doctor, to prevent the upper airway obstruction?
Yes. By this position, you can prevent the glossoptosis. And this is the only condition allowed you to advise the family putting the patient on this position, because the normal position for newborns, for infant, is putting on the supine position to avoid what?
Sudden infant respiratory death syndrome.
Yes, to avoid the SIDS, sudden infant death syndrome. But in Pierre syndrome, you can't put them on prone position or sideline. طبعا awake baby you can't put on prone position، ما عندنا مشكلة. طفل قاعد تحطه على وجهه لأن هو أكو عنده defense mechanism reflex, he will deviate his mouth, his face right or left or elevate his head، فما راح يصير عنده obstruction. اللي يخافون عنده هو during sleeping. هاي normal babies. زين. This patient you can see here, they have cleft palate and he is with respiratory distress, so he is using nasal cannula. You can see the small chin here. Now, this patient, if I said this patient has Pierre syndrome. Why? Because of the presence of a small chin. What is other thing? Pay your attention.
Tracheostomized and lost ear.
Very good. Tracheostomy. So this device here is for tracheostomy. And why this patient undergo tracheostomy? To overcome the upper airway obstruction by nose. Sorry, by tongue. Feeding difficulties in those patients. Some of them, they may have also laryngomalacia, exacerbate the problem also. Why this baby is crying? And what's wrong with it?
Have large tongue, microglossus.
يعني هو ده يبتدي عنده large tongue؟
لا هذا هو الرتبم يعني بس يعني هو الابنورمال عنده large tongue.
Have protruded tongue because of the true macroglossia. You can see here this is a large broad tongue. What other abnormality you can recognize here?
Microcephaly.
How do you assess this?
يعني هو by looking مو
ايه صحيح بس how?
يعني compared to the face فالhead.
Yes, very good. Comparing size of the face to the head looks microcephaly, and this is correct. Oh, this young lady with a large tongue protruding, because this is a true macroglossia, not like what happened in Down syndrome, protruding the tongue because of a small oral cavity. So هذا ابو Pierre syndrome, Pierre syndrome, protruding his tongue ما صارت مشكلة ذاك يصير عنده glossoptosis. So we are talking about a syndrome called Beckwith-Wiedemann syndrome, and it has a lot of abnormalities, dysmorphic features, congenital abnormalities, but the classic type for it is the macroglossia, umbilical hernia, and omphalocele. بعد شعتهم تتذكرون من العام الماضي ذولا شو ممكن يصعدهم البيكويث-ويدمان syndrome.
Large for gestational age?
Very good, large for gestational age. وبعد because they are large for gestational age, there is a
Hypoglycemic.
نعم.
Hypoglycemic.
Very good, very good. They are hypoglycemic because of the hyperplasia of islet cell of pancreas. If you remember the causes of neonatal hypoglycemia, it may be because of low substrate of the glycogen that happened in small for gestational age or patient with premature babies, or it may be because of the hyperplasia of islets, it's hyperinsulinemia, and one of the causes, it may be infant of diabetic mother, or it may be because of the Beckwith-Wiedemann syndrome. So, metabolic inborn of metabolism also causing hypoglycemia. So we are dealing with patients, they have macrosomia or large for gestational age, both weight and length is more than 90. لأن هذا more than 90 راح يساعدنا more than 2 standard deviation of the median. صح لو غلط؟ زين. So they have macrosomia. They have ear crease or pit. البارحة شفنا البit. البit قلنا alone, isolated, it is a minor congenital anomalies, but if it associates with other problems, with other abnormalities, it may be part of disease like in Beckwith-Wiedemann syndrome. So ear crease or pit, visceromegaly, especially the adrenal gland. So not just the whole size of baby is large, but there is also visceromegaly, liver, spleen, pancreas, and even the adrenal, or especially the adrenal glands. Although they have large size, but they have microcephaly. And this microcephaly putting them under the effect of severe intellectual disabilities. They have hypoglycemia because of the hyperplasia of islet cell, and they have renal abnormalities. They may have polycystic kidney, hemihypertrophy. The meaning of hemihypertrophy, they have one side of the body is hypertrophied, larger in size more than the other side. So this is the hemihypertrophy. Cardiac malformations, the type of cardiac malformation, they may have VSD, ASD, or they may have cardiomegaly with increase the thickness of the intraventricular septum, like what happened in patients with infant of diabetic mother. They have cardiomyopathy with biventricular hypertrophy. Intestinal malformations, amphiloceal is very clear example for intestinal malformation. Solid tumor, Walm's tumor, it is of high incidence in those patients with this syndrome, and of course, as I said, severe mental retardation. So this patient with Bickwood-Wiedemann syndrome, and this is the ear creases like this on the earlobe, creases. And here is the ear pits. The normal is preauricular pit, but here in the auricle itself. And this patient has severe tongue, severe microglossia, and after doing surgery for this patient, his tongue diminished in size. They try to decrease the size of tongue, and how they say affect يعني 24 ساعة طلع لسانه حتى even affecting the breathing, affecting the feeling also. So this is a surgical reduction of microglossia. هذا التشبيه. What is wrong with this sleepy baby?
Protruded tongue.
Protruding tongue, yes. وبعد
cyanosis.
No, there is no cyanosis. هذا مو cyanosis. هذا مو cyanosis. Look at the color of the tongue and lips. It's normal. هذا ايش عنده هنا؟ يلا وين the other participants?
Dull face with the protruded tongue.
شبيه الفيس؟
Looking dull or apathy.
لا, apathy. This is not Down syndrome. Away from Down facies. But yes.
No, I mean dull, not down.
نعم؟
Dull face.
dull face. بعد يقولين down. Yes. Apathy. نسميهم apathy. It's better than dull face. And protruding tongue. وهنا شوية بعد جمعنا more criteria. What we found in this slide.
دكتور هذا عنده jaundice.
Jaundice. And
umbilical hernia.
umbilical hernia. And he looks
Slightly protruding.
and he looks apathy. So we are talking about the congenital hypothyroidism. Shabab. Congenital hypothyroidism is very important issue in the United States and in many countries, especially in developed countries. They did screening tests for hypothyroidism. Why? Because early diagnosis, early detection with early treatment, the result is excellent. While if there is a delay, of course, there will be a degree of mental retardation. Now, the presentation of هو ليش يسوون screening؟ يعني معناته before appearance of the clinical feature. هذا معناته screening. So the presentation, of course, sometimes it's not all the full-blown picture of patient with congenital hypothyroidism they have. But if we are going to enumerate the classical, the patient are apathic. يصير always he is sleepy, drowsy, lethargic, low pitch cry. بعد شو يصير عنده prolonged jaundice. Prolonged jaundice والjaundice يكون off mostly indirect. ليش يصير عندهم prolonged jaundice patients with hypothyroidism?
Decrease in metabolism rate of liver.
So decreased conjugation of the bilirubin leads to indirect hyperbilirubinemia, prolonged jaundice. For the same reason they have decreased metabolism, they have hypothyroidism. They have constipation, and they have umbilical hernia. هذه ندور عليهن بس مو شرط كلهن نلقاهن. زين؟ لكن او مرات اصلا الطفل constipation ما يجي على مود constipation. And then visit us for the other problem. مرات على prolonged jaundice. زين. So this is the presentation of patient, the main presentation of patient with congenital hypothyroidism. شو راح نسوي احنا؟ Sending for the TSB, direct and indirect fractionation, to see if this is direct or indirect hyperbilirubinemia, and doing thyroid function test. This is very important because early detection, early treatment, excellent prognosis. And radiologically, they may have abnormal finding. If هذا patient has with hypothyroidism, he is lethargic, protruding tongue, has jaundice, and abdominal distension with abdominal or umbilical hernia. Radiologically, those patients may have absent of the distant lower epiphysis, like this. شو هذا هو lower femoral or distant femoral epiphysis. Now, very clear, هنا just appear. لكن هنا absent completely. This is frequently seen in patients with hypothyroidism. لكن مو معناته إذا دزينا إكس-راي ولقينا أنه عند الديستال femoral, this is excluded. No, لازم نسوي thyroid function test. Absent distal femoral epiphysis. How the same or other X-ray show the absence of distal femoral epiphysis. زين. هذا شنو تشوفون؟ يلا.
Sun-sitting eye and left jaundice.
هسه احنا الجوندس نعوفه لانه ممكن يكون هذا هجفد لايت اكسبوجر. لكن sunset eye. sunset eye ليش تصير؟ وين نشوفها؟
هيدروسيفلس.
Hydrocephalus, yes. Another sunset eye. وإذا ناخذ الصورة كاملة راح يبين عندنا الهيدروسيفلس. Like this slide, maybe the question, what are the differential diagnoses مثلا؟ أطلب من عندك. فكنت تعرف الهيدروسيفلس it's classified into obstructing and non-obstructing. تقدر تعطيني فد example for both؟ يعني فد one example.
obstructive شو اسمه tumor على ال most common in the شو اسمه in the between third and fourth بالاكويدكت stenosis.
اي aqueduct of what شو يسموها هذه؟ aqueduct
of Salivin. أو يكون non obstructive مثل المننجايتس.
Very good. Communicating يسموها at the same time, non-obstructing or communicating. وعندنا طبعا a lot of causes. ممكن يكون question like this. نجي إلى to other subject. How you can comment on this slide. ليش ما البقية ما يجاوبون؟ خلينا نشوف. لحظة. لا أحد يجاوب من يمه. خلينا نشوف. أبرار.
نعم دكتور.
يلا.
protruding viscera from the umbilicus in a female neonate.
إيش بيها هاي الفيميل نيونيت؟ شنو هذا اللي تشوفيه عندها؟
Visceral protruding from the umbilicus.
Protruding from the umbilicus. Okay, viscera. تحددين what is the type of viscera seen here?
Intestine.
Intestine. Okay. This is gastrous cases, and here there is no protrusion of the intestine from the umbilicus. It's from an abdominal defect adjacent to the umbilicus. Here's the umbilicus is intact. You can see this is the umbilical cord, normal. and the protrusion here is from a defect in the abdominal wall to the right of the umbilicus.
شرحنا بالجراحة إنه 100% intestine.
100 شلون بابا؟
100% intestine.
Yes, 100% intestine. Yes, you are right. In gastrous cases only intestine. صحيح. هسه ما دامك انت جاوبت او تدخلت، هسه انت لازم تجاوبنا هنا. يلا.
لا شو اسمه انفالوسي لان مغطاة بشو اسمه
مغطاة بشنو؟
يعني ممبرين.
شو يصحوا له هذا الممبرين؟
هو الامنيوتيك ممبرين.
امنيوتيك ممبرين؟ شنو علاقة الامنيوتيك ممبرين؟
لا قصدي نسيت. انا اتذكر هيك شيء اخذناه بالجراحة، يعني البيريتون قصدي شيء. بيريتون ايه
هذا هنا يصحوا له الهرنييتد ساك.
ايه الانفالوسي.
peritoneal wall. This is omphalocele. ليش؟ Here is the defect or the protrusion is from the umbilicus itself. Here is the protrusion of intestine, of course, and may be associated with viscera. اللي هي منو؟ liver and spleen. احنا بنقول viscera عادة نقصد بها الليفر and spleen، لكن الانتستين ما يخالف مشيناها. هذا اللي نشوفه هنا maybe a closed herniated sac like this، وهنا نشوف the umbilical cord on the top of، لأنه هو صاير within the umbilicus. زين. Here is a ruptured herniated sac. شو طالع from the umbilicus ruptured herniated sac. وهنا ايش نشوف؟ هذا شنو هنا؟ شو مبين هذا؟ liver.
gangrene.
لا liver. This is liver. هو هذا اللي نقول عليه. viscera may protrude with the intestine. وهذا مكمل umbilical cord on the top of the ruptured herniated sac. هذا يصحوا له omphalocele. So we should differentiate between gastrous cases and between omphalocele. Gastrous cases, here is the umbilical cord and the umbilicus is intact. There's nothing with. But there is an abdominal wall defect in most of the cases, in all of the cases تقريبا, on the right side, and only the intestine herniated. من نجي نباوع لها منا تكون like this. يعني هذا شنو هذا؟ هذا section كأنه coronal or transverse section. فشفنا transverse section, high umbilical normal, and this is the defect in the abdominal wall. وطالعة فقط منه الumbilicus. Sorry, the intestine. While in omphalocele, no. There is a protrusion of the intestine, maybe with or without viscera, through the umbilicus itself. So we have what's called the herniated sac, of course, containing peritoneum. هذا الperitoneum. And it may be ruptured. And the umbilical cord is over it. قبل لا نروح على هذا السلايد، لسه ذكرنا انه الانفالوسيل can be seen in chromosomal abnormalities like Edwards syndrome or Pater syndrome. زين. While the gastrous cases نلقاها اكثر شيء isolated abnormality. The incidence of gastrous cases is more than the incidence of omphalocele. لكن من نشوف الانفالوسيل ما نكتفي نقول this is omphalocele we should correct it alone. لازم ندور other abnormalities. ممكن يكون عندهم renal defect، ممكن يكون عندهم congenital heart disease، لأنه ممكن تكون part of disease, rarely to be seen and as an isolated congenital abnormality. Treatment of course اكو يصحوا له elastic membrane يخلوه over the herniated loop of intestine, and the conservative management immediately until preparation for the surgical intervention to reintroduce the intestine with viscera if present inside the abdominal cavity. شو نشوف هنا in this baby؟
دكتور هذا newborn male with abnormality.
لا خلاص لا خلاص. محمد حسين عماد.
نعم.
يلا محمد.
newborn with wrinkled skin in the abdomen.
وليش صار wrinkled skin on the abdomen؟ ايش تعتقد؟
defect بالمصل maybe.
Defect in the abdominal muscle wall. Yes. This is a wrinkled skin in the abdomen only, not on the other part of the body. And this is because of defect. It may be completely absent or just defects. This is called the prone belly syndrome. Belly abdomen. Prone شنو هاي البرون؟ من يعرف شنو البرون؟
جوجة دكتور.
But which جوجة؟ It is dried. لأنه إذا كانت فريش جوجة نسميها plum. هاي الفريش called plum. وين تدرايد وصير كلش طيبة يصيحوا لها prune. بالمناسبة جوجة it is a Persian word. شنو بالعربي شو يسموه هذا؟ جوجة هاي كلمة فارسية. الجاس يصيحوا لها باللغة العربية. زين. Okay. So it's like the prawn. أنا قلت لكم دائما the يعني الأمريكان British يستخدمون التشبيهات. So this picture of patient with abdominal wall defect, given the picture of wrinkled abdomen, this is called the prone belly syndrome, which is an autosomal recessive disorder. Affect the male more than the female. In those patients, they have the abnormality in the wall of muscle of the abdomen, and they have renal system abnormalities. They may end with renal failure, and they may have congenital heart disease also. So lack of abdominal wall, it may be complete or partial, leading to this picture. They have undescended testes. They have vesico-uretral reflux, leading to hydroureter or large ureter, with distended bladder, leading to UTI and leading to renal failure. They have, as I said, congenital heart disease, mostly in form of VSD, and they have also GIT abnormalities in form of malrotation of gut, and they may have also club foot. Patients, they are poorly prognosed. They have poor prognosis if they have prone belly syndrome, and there is delay in the management. لأنه ممكن يصير لهم renal failure because of the distended bladder, and يعني يصير obstructive uropathy راح يصير عندهم معناته ويؤدي إلى renal failure، وطبعا يسوي chronic or recurrent UTI.
بس دكتور بالريسبيريشن ما تأثر لأنهم أكثر شيء يكونون abdominal. يعني يصير عندهم
yes, it will affect on the respiration. صحيح. زين. هذا شنو نشوف هنا؟ يلا.
Lateral X-ray of the trunk and lower limb show air inside the rectum with the absence of anus.
Yes. هسه شو يسموها هاي الكيس؟ يصيحوا لها imperforated
anus.
Imperforated anus. Which type? How many types of imperforated anus we have? خلي واحد غيرك يجاوب. لحظة لا تجاوب انت. خلينا نختار. غفران ناهض. غفران ناهض. ياسر نجاح.
نعم دكتور.
يلا يا أستاذ. How many types of perforated anus we have?
دكتور صراحة ما أذكر يعني.
ما تذكر. زين محمد هادي.
نعم دكتور.
يلا how many types of perforated anus we have؟ هاي المفروض بالسجل انتم ماخذيها.
نعم دكتور.
اي how many types؟ didn't remember. خلينا نشوف. هدى محسن.
بلي دكتور. Two type.
اي.
Low type,
which
high
is
type.
low type and high type. زين هذا ايش تعتقد which type؟
Low type.
low type. Very good. Thank you. شاهد يعقوب.
نعم.
What is the measure of low type and perforated anus؟ شلون يعالجوه؟
Correction.
اي بس شلون يعني؟ صحيح surgical correction.
I don't know.
You don't know. زين جعفر جاسم.
نعم دكتور.
اي management of low type and perforated anus.
يعني هي making a new
لها اسم بابا شو يسموها؟
الانوبلاستي دكتور.
surgery anoplasty. One stage anoplasty. While the high type شو يحتاجون؟ عندك فكرة ولا لا؟
لا والله دكتور.
غفران مناف.
الهاي تايب ممكن يحتاج جاستروستومي.
غفران علي صوتك بابا.
دكتور الهاي تايب ممكن يحتاج جاستروستومي
نسوي له شنو؟
جاستروستومي يعني.
جاستروستومي؟ ليش جاستروستومي؟ قصدك غير شيء. طيب قصدك كولوستومي نسوي. كولوستومي وبعدين نسوي of the anus. يلا اوكي. هذا هو imperforated anus. And in neonatal examination, in routine neonatal examination, if you miss the examination for the patency of rectum, you did, or anus, you did a major mistake. من يقدر يقول لي ليش؟
يعني يصير intestinal شو اسمه بعدين perforation اذا شو اسمه ماكو ها فإنه يجي بعدين كأكيوت ابدومن.
يجي أكيوت ابدومن. زين. يعني أنت كنت تحكي لنا اياها بطريقة أكثر منطقية. مريم علي.
نعم دكتور.
أنتِ تفحصين طفل نيونيت استوى أجل الدنيا، فحصتي وهي لوكس ويل وقدمتي له كل الكير اللي يحتاجه اللي راح نتعرف عليه إن شاء الله بالسيشنات القادمة، وسلمتي لأهله بس you miss examination for the patency of anus. ليش اللي سويتيه يعتبر major mistake؟
يعني هو حتى يشوف الباتنسي مالته غير؟
إيه على مود تشوفين بس أنت ما شفتيه وارتكبتي خطأ.
يعني
هو ليش
ممكن راح يصير يعني كولكشن يعني بداخل يعني بالانتستين ما راح مثلا
ما هو كان بضمه perforated anus ما المشكلة.
الميكونيوم.
ايش بالميكونيوم؟ ماشي. خلينا نشوف محمد عبد الوهاب.
نعم دكتور.
يلا محمد.
دكتور تصير فيستشولا.
يصير فيستشولا. أحمد وليد.
دكتور حتى نشوف يعني الماسكليشر مالته.
ماسكليشر شو لها علاقة يا أحمد؟ هذا طفل كان لازم تفحص الانس مالته ونسيت وطيتها لاهله. زين؟
نعم.
بس انت انتبهت بعدين ذكرت قلت نسيت انا افحص ما ادري بيه هذا طيته لاهله. شو المشكله هسه؟ وين اشوفهم؟ وين اخابرهم اقول لهم يرجعوا لي؟ وهم هم ايش سووا؟ راحوا الناس للبيت. زين؟ هسه نريد نسمع جواب من اي واحد يعرف يجاوب مو بالاسم. راحوا للبيت، الطفل يخبل، رضعوه، يوم بالليل الطفل ايش عنده؟ بايل ستاند اب شنو هذا؟
يعني
obstruction. طبعا هذا عنده obstruction وانت بديت تعطيه فيدنج ايش راح يصير عنده؟ زين؟ راح يصير عنده intestinal obstruction. يجيك بايل فوميتنج، ريبيتد فوميتنج، يصير عنده abdominal distension، وممكن يصير سبسس. ممكن يصير حتى سبسس ينتهي. والغلط كان يمس the examination of the. طبعا اذا انت لقيته passing meconium خلص بعد هي patent بنتهي من عندها. لكن اذا not pass meconium، لا احنا قلنا الميكونيوم ممكن يتاخر الى ان يطلع ايش وقت؟
up to 2 days.
يعني ممكن up to 99% بالفيرست 24 اور. زين؟ وذول الريمينينج 1% بال 48 اور. انت سلمته ورا ساعه ورا ساعتين من ولادته، فيعني نورمالي انه هناك باس ميكونيوم تل ذس تايم. زين شلون تعرف انه هذا هو؟ لازم انت تسوي اكزامينيشن، لانه انت ما تقدر اساسا ما تقدر تبدي feeding for the patient الا ما تتاكد انه the patient has a recognizable bowel sounds، يعني positive مو positive عاديه، لا active bowel sounds. I'm متاكد انه الانتستين working normally. يلا تبدي انت الفيدنج. زين هذا اساسا هو عنده بس وين راح الفيدنج اللي اعطيت اياه والميكونيوم شو راح يسوي لك؟ زين مشكله. زين هسه خلصنا احنا. خلينا نشوف هذا الكويز. This is a real patient and this is my hand. يلا findings in this patient.
Lost air.
Lost air. مو كله امير لا تجاوب انت بعد. ترى قمت تضوجني. قمت تضوجني امير لا تجاوب بعد. احمد علي. ماكو احمد علي. استبرق وفي.
نعم دكتور.
يلا استبرق شو تشوفين؟ امير قال له ستير، انت ايش تقولين؟ ايش عنده بعد هذا؟
مايكروغنيثيا ممكن؟
مايكروغنيثيا. ايوه بعد تشوفين؟
overlapping of hand.
Very good.
Of finger.
Overlapping of fingers. زين. Same patient. زين شنو هذا اللي عنده مايكروغنيثيا وعنده لوسة اير overlapping؟ شو تفكرين شنو الكوز مالته؟
دكتور Edwards syndrome.
Edwards syndrome. So this is one of the rare cases that pass or they live more than 1 year. هذا البيشنت عمره كان يمكن سنة و3 أشهر وكانوا يراجعوني باستمرار for failure to thrive، وعنده كان يصير recurrent chest infection لكنه congenital heart disease ما عنده. الايكو مالته normal echo. kidney is also normal. يمكن يكون هذا هو الكوز of انه البيبي surviving. كان failure to thrive، عنده poor appetite poor feeding وعنده recurrent chest infection. الله يراجعوني فترة يعني تقريبا السنة الثانية من عمره كلها، وشو بعدين اختفوا ما أعرف إذا أنه pass راح to other doctor ما أعرف. المهم هاي one of them their visits. زين هاي بالاستشارية مالت مستشفى الزهراء. هذه other picture showing the overlapping of fingers، وحتى ممكن نشوف اللوسة ear. هذا هنا هسه واضح عندي the prominent forehead, upturned nose, micrognathia and the hypertellurism. هنا اجي نشوف واضح عندي ال prominent occiput, low set ear, prominent forehead وال small jaw, upturned nose. All it's clear in this slide. هذه بعد اوضح هنا. هاي نفس الصورة اللي حطيت لكم اياها. انه ال prominent occiput with forehead with low set ear. Very clear. And this patient. هذه هنا شنو نسميها هاي الساين؟
scissor position.
لا scissor position هاي صحيحة، لكنه الفيت rocker bottom feet, prominent calcaneus bone and arching of the feet. Then هذا ايش بيه هذا؟ يلا امير هنا انت لك حق تجاوب. جاوب امير.
عنده مايكروغانثيا.
مايكرو شنو؟
مايكروغانثيا.
جناثيا، مايكروغناثيا. لا والله كل شيء ما عنده، هذا ضايج. ضايج من عندك هذا. زين؟ يلا خلصنا. احد عنده سؤال؟ احد عنده سؤال؟
سبكوتينيوس فات نكروسيس يصير بالابدومين لو بس يعني الباك او
mostly on the back, mostly on the back because there is a thick skin on the back more than the front.
تمام شكرا.
بعد احد عنده سؤال؟ إذا ما حد عنده سؤال براحتكم.
عشان